Hey, this is Dr. G and my friend Jade Lamini, licensed acupuncturist, and today we're going to go into our story about how we got into acupuncture, the benefits of PT, acupuncture, yoga, and chiropractic combined together.
Yeah, welcome everyone.
So, Jade, I know you have an interesting story about how you got started into acupuncture. Give us a little bit of insight on that.
I was in my 20s before I had heard about Acu, but I'd never experienced it. And I only pursued Acu as my last resort. I was a paralegal at the time. I did a lot of typing every day. I loved my job, but I started to develop a cyst. It's like a water cyst or a ganglion cyst on my wrist, only on one side. And at times I would also feel it in my elbow. It caused radiating pain. Working every day with it became painful. And I was like, what can I do? I went to my primary care doctor, and he didn't have an answer. He said, you know what we do with that? We slap it with a Bible. And I said, I was like, well,
Literally.
literally, yeah. And my dad had told me the same thing, so I thought that was funny, but that wasn't the solution I was looking for. Because I said, what happens then? And they said, well, it'll probably come back. They said we could drain it, but it'll probably come back. And I said, well, how do I get rid of it? Like, I'm so young. I shouldn't be having these lifetime issues that's going to constantly
How
keep
old were
coming
you?
back. Like 23, 24, something like
Wow.
that. And eventually I started researching, and I realized it could possibly be an issue with circulation. And I found an acupuncturist. And after about 3 or 4 treatments, she put a few points in my wrists. She put a few points in my shoulder and my abdomen. And I was like, let's just see how it goes, right? What else? Because nothing else is working. I also went for for acne at the time. And I didn't think it would work, but she said something to me that really stuck to me. And I feel like that was the moment, that was like my aha moment for acupuncture. She said, oh, this is an issue with your small intestine. And I was like, there's nothing wrong with my small intestine. Why would she say that? And I went home and started researching, and I realized what she was referring to was the small intestine channel, because it's from the pinky, and that cyst that I had went right along the channel. And I was like, oh, so there is some science to this. And from there, I started researching how you do it, where do you learn, and I just got just full of passion with it. And I loved my job as a paralegal, but for me, it felt like Acu was that aha moment. It made a tremendous change in my life. It cleared up my skin. It cleared up that cyst, and I've never had it ever again. And it's something that women in my family do deal with. An uncle of mine also had it. So it's a water metabolism issue that runs in the family, and Acu fixed it for me. So I love Acu for that reason, and so much more since then.
So that's so interesting because cysts tend to be idiopathic or no reason why they happened. Some science shows that excess sugar in the diet, sometimes it's hormone imbalance. Another reason, like you were saying, it's water metabolism. Some of these cysts are deposits of fat, and they're not fluid. And so I've heard of hitting it with a Bible before. Sometimes we've seen that depicted in movies. Your grandma or great grandma have actually experienced them themselves. That's some of the old wives' tale medicine.
Yeah.
There is some truth to that. I think it's when it's like more fluid filled, but
Yeah.
then you hear the stories about when it's not fluid and it's like more fatty tissue,
So painful.
and then then they break their wrist or they smash their arm and it's still there.
Yeah.
And now you have a bruise and a cyst.
Yeah, there you go. Exactly. What about
That's-
you? How did you
Well,
first get into Acu?
So for me personally, it's I was involved in a car accident when I was 16. Really, really bad car accident. I was driving a very small compact car at the time. It was
Of
only-
course, right?
that's
16,
my,
right?
my first car, first used car, and I got hit on by a Crown Vic cab, all steel. It was probably 1,000 to 2,000 pounds more than my car,
Oh, God.
and it looked like my car fell off a cliff. It spun. The battery, the engine ejected. My seatbelt saved my life,
Oh
but
my
from
gosh.
that wreck, I was really left in bad shape.
Yeah.
I mean, my spine was kind of twisted. I was experiencing neurological problems. And then I couldn't move very well at all because everything stiffened up, became rigid, and was extremely painful.
Right.
And so I was like, I guess I need to get treatment now. So I was at the physical therapy office, and the acupuncturist came up to me. And at that time, I didn't even know what that was, acupuncture. And he says, he's now my friend now, Tom. He goes, you want to try some acu? It's covered by insurance. And I was like, whatever that is, let's give that a try.
Yeah.
And so I started trying it. And after, about a week or two of some treatments, I was like 80% better. And they were predicting that I wouldn't start to feel that much better for at least 6 to 8 months.
It's amazing.
And so I continued on, and within a month or so, I was all better.
It's awesome. That is so
And
awesome.
my strengths are math and science.
Yeah.
Like that's really only what I'm good at. Yeah. So I I was like, I can always do something that works. I can always be proud of a profession that's helping people, and the fact that there must be science behind this because
Yeah.
it did work.
Yeah.
Let's go find out about it. Even though where others were saying that, that's crazy. That's not a thing. No one's ever heard of that.
Oh
And
yeah.
I was
I mean,
like,
I'm sure at 16 you probably got a lot of
well,
doubts.
no one, no one really actually paid attention, to what someone that young says, right? But then
Yeah.
when I started going to school for it, and they're like, "Wait, you're doing that thing?"
Yeah.
I'm like, this works. This really works. And now that I've been going to this field, I'm meeting a lot of people who've told me their stories and
Yeah.
that it works. And I'm like, okay, well maybe there's not a whole lot of studies that are completed right now, but we are seeing positive studies come out, and they're not conclusive yet. And fast forward 10, 15 years later now, the studies have come in. Acupuncture is covered by the VA.
Yeah.
It's covered by so many insurances. It's been recognized through no fault workers comp,
Workers' comp, yeah.
for a very long time now. And the government doesn't pay for things, and insurance doesn't pay for
That's right.
things that don't work if they don't have science. Does acupuncture work for everybody? No. But I'm hard pressed to find somebody who it didn't work somewhat for. And
Right.
the majority of people that I see and that we treat, they have big improvement. Maybe they're not 100% healed, but they might reach 80% better within a short period of time.
Yeah.
And it is better than the therapy that they have been currently getting, the drugs that they've been taking,
Yeah.
and the non-answers that have been conclusive that they've been getting already. And now there's a treatment that makes them so that it's manageable. And for a lot of people, they're like, I don't even feel the symptoms anymore.
Exactly.
Sometimes I have to come in for a little bit of maintenance,
Yeah.
but so what? I enjoy
It's
coming.
worth it.
This treatment not only helps the pain I was having, it's been helping my metabolism. It's been helping me sleep better. My energy's up. I'm in a better mood, and my symptoms, it keeps them all gone.
Yeah.
And the treatment itself is really is an amazing experience. Like you just have like this restful, like you've had the best sleep of your life, and you wake up 100% refreshed, but it's only been 45 minutes.
Yeah.
And as an adult, when can we say that? Hardly ever.
Hardly
And
ever.
that was the therapy that helped all your symptoms and all those other problems that you were having. And then for women specifically, we help infertility
Yeah.
and PMS and all different kinds of disorders.
Yeah.
They come in for their neck pain, and all of a sudden their PMS is gone.
Yeah. Endometriosis, it's like all of these issues that people deal with, and they come to accept them as lifetime issues. Like I could have accepted that, no matter what, it's always going to keep coming back no matter how I treat it. And acupuncture provides solutions where many other therapies cannot. And to me, that's the beauty of acu. I mean, we have answers where people, basically where people meet their end of the road, where they think that there's no other answer. They come into the office and they're like, I wish I came in sooner. We hear that so often. I wish I found you guys sooner.
That is the most common complaint in this office.
Yeah.
The thing that people most are upset about is that they didn't come sooner.
Yeah.
That's the most common cry I hear in the office. It's never anything else. So, and they're always feeling better. Sometimes we hit a plateau, but
Yeah.
only for a treatment or two. But the common complaint is, why didn't I come sooner? You were the 8th provider. You were the 8th person I saw. It's been over a year or two, and now I'm starting to feel relief. How come no one told me about acupuncture?
Yeah.
Whether it's us or your local acupuncturist, or it's you called us to get advisement on who you should see for your acupuncturist because you live far away,
Yeah.
or if you're calling in just to ask us or email a question like, would acupuncture help my current situation or condition? We're always happy to field those questions and answer them correctly and point you on the right track. Unless you're in a critical emergency, like you have to get to the ER, unless you have to be in the hospital, you should call your acupuncturist first. We can often tell you the best way to get better, whether
Yeah.
it's you get PT or chiropractic or do more stretching or yoga or change your diet or come in and see us. We can usually get you through the medical system faster,
Yeah.
and advise you on the right track the first time, because we advocate for traditional Western medicine too. We believe in drugs and surgery. We're integrative family wellness over here, right? So it's like we believe in all medicine. We need all of it. It just depends upon which ones you need at the certain time that you're in.
Yeah, all medicine is good medicine. It's just there's a time and a place for everything at the same time. Yeah.
You know, which brings us to a good point. So, oftentimes when you're going through a trauma or you're going through rehab, you know, it's you're going to one place and you're getting one or two types of treatments. So maybe you start out at your physical therapist,
Yeah.
right? And most of us go to PT because we get a referral from our physical therapist, from our doctor,
Yeah, primarily.
right? And we see half of our patients who see us, they're getting physical therapy. We treat a lot of pain conditions. We do a lot of rehab.
Yeah.
And so they say, you know, I've been going to PT and I don't know how I feel about PT, and I feel like now I've hit a plateau, or what more can I be doing?
Right.
You know, to get better fast. Everyone wants to get better now and faster, and without drugs, because no one wants to take that long term. And what your physical therapist is doing is regaining range of motion, flexibility, and strength in your motor movements. That's what your physical therapist is doing to the most extent.
Yeah.
Now, what can be still causing pain and keeping you from getting better faster is tight muscles, trigger points, adhesions, poor circulation, the neurology, the nerves not firing into the area correctly.
Yeah.
Inflammation.
Did,
full of inflammation, and your physical therapist is for the inflammation is using ice. They might be using some ultrasound, right? They're getting you to move to circulate the blood.
Yeah.
Oftentimes it's painful there.
Yeah.
You just had an operation, you just had a trauma or injury, you're in rehab, and they're saying, okay, now move this and lift that and stretch this, and you're like, this really hurts.
Right out of surgery.
Right, yeah,
Right
this really hurts.
Surgery, they want you moving.
I feel worse from doing all this movement. Is something sometimes I hear, right?
Oh yeah, I mean often. I mean it can be tough when you're recovering from a surgery. I mean, they want you moving right away. Hours after the surgery, they will send a PT in and get you moving. And it's important. It's necessary therapy, but it can be painful, and the recovery is tough. Takes a lot out of our patients when they're going to PT or just enduring those type of therapies, and it's great for them. But I feel like Acu's fantastic because we can help people recover from those that soreness, that weakness that you're feeling. Acupuncture in itself, we can modify treatments to help people with their endurance, to help people with their overall feeling of weakness, exhaustion. You can get a quick rest on the table, like you mentioned, and feel better after. Feel even ready to go back to physical therapy. You know. So I think that's important that Acu and PT are combined.
Yeah,
PT
so
is fantastic.
We should talk more about this PT, right, and how specifically acupuncture is going to help them.
Yeah.
And we tell patients time and time again, yes, go to your physical therapy, but the way acupuncture is going to speed this up is I wish everyone looked up. I wish they Googled trigger points, adhesions, restrictions, myofascial restrictions in the tissue. And I think we can zoom in here on this muscle man right here.
Yeah.
And so all this red here, this is all muscles. These are all muscle fibers right here. So why don't we take right here, we'll use something very common, which is the knee.
Yeah.
So this is the person's knee right here. And all this white stuff, these are all tendons, and tendons turn into muscles. And so what happens here is these trigger points and adhesions, they're like little rocks of tissue that form stuck right in there. And now here is supposed to flex and contract. You know how you flex your bicep and it gets big?
Yeah.
It's because it contracts into each other. And if there's a rock of muscle tissue stuck in the way, when you go to do that movement,
that we're looking for.
it
and
hurts.
Pain.
It hurts when you go to do it. So acupuncture is perfect to speed up physical therapy. Is we go in there and we break it up. We just do this and we break it up.
Yeah.
And now the blood goes in there and it brings circulation. And now all of a sudden your knee feels better because the circulation is now able to get past that rock of tissue that's now softened up, and now it's come down into the knee.
Carrying that fresh nutrients that's needed to help with the repair.
How often do your patients tell you that when you put a point in around an area that all of a sudden it feels warm?
Yeah, often.
Or they feel tingly, like a warm tingly, not like a bad tingly.
Yeah.
Or something, or movement, or like there's a shift almost.
movement, like
After we put in a needle, and these needles are not painful. They're very thin. So we found a rock of tissue right up here, and we loosened it up real gentle. And now the blood starts coming through, and within a few minutes, all of a sudden you feel warmth happen to your knee, and your knee's been killing you.
it's the blood rushing.
And now it feels somewhat better.
Yeah.
And then now kind of comes down here. Now you kind of feel it into your foot. And some people have that sciatica, or sometimes they have cold feet, or sometimes they get spasms in their legs, right, in their calves. And I know we hear that sometimes that's a potassium deficiency and magnesium. That's also true, but sometimes you just need more blood in the area.
Yeah.
And the more things you can get to loosen up the circulation, like if you have a bunch of rocks of tissue stopping up circulation, the more blood flow that comes down. Now that helps your muscle spasm somewhat. And now that your foot doesn't feel as cold as it did, and then you were coming in for knee pain here, and now that knee it doesn't hurt that much when you go up and down stairs. And you did a couple treatments of that, and you combined that with your physical therapy.
Physical therapy, yeah.
And now all of a sudden, instead of taking months, it took a couple of visits.
Yeah.
And that's the kind of progress we see when you combine PT and acupuncture.
Yeah, all the time. It's a beautiful process, and I love that we're able to offer that therapy. I mean, it's symbiotic. I like it.
We have partnered with a lot of other healthcare professionals because we're integrative family acupuncture massage therapy. I mean, we're integrative family. We believe in all types of medicine if it works for you. I mean, we have chiropractors we work with. Now, some people love chiropractic. Some people prefer PT or acupuncture over it. I believe in combining acupuncture with chiropractic. Now there are all different types of chiropractic. Some people love the big adjustment or the big pop.
Yeah.
A lot of chiropractors sometimes will use a softer technique, more of a stretching, more of a gentle pressure. What they're actually doing is they're putting back some bones into alignment to create circulation, and they're stretching out the area to bring circulation back and heal the area.
Yeah.
Okay? And so the way that acupuncture helps you with your adjustment. Okay, let's turn this around. All right, so so the spine is buried in all the muscles here. Now we have all these muscles. And they all pull on the spine. Now you might be having neck and back problems, and the chiropractor puts back those bones in the right direction.
Yeah.
So now your neck feels better. And a lot of chiropractors, they've already stretched out and loosened. They put the TENS unit on you. They put heat therapy.
They incorporate massage therapy at times too.
They do.
Yeah.
They put different creams on. And what they're really trying to do there is loosen up all this red. This is all these huge postural muscles. They're extremely strong. And they pull directly on the spine here. And they're trying to loosen that up first. And then they push back in the bone to get in the right alignment.
Yeah.
Now, a lot of times our muscles there, again, have the same problem. They have those rocks, those adhesions, trigger points, and that really hard tissue. And it's causing this tension in one direction. And what happens is, you massage it, massage therapist or physical therapist or chiro, they massaged it up a little bit, but no one broke it up.
Right.
It didn't get broken up. So after a couple days, it starts pulling back on the spine again. And you're like, I went to PT and chiro and I felt great for a while, but then it came back.
Yeah.
You know, how many times have I heard it just came back?
Yeah.
Now, did they do the wrong thing? No. Your chiro PT, they did the right treatment. But we needed to have broken up those trigger points. So whether you get that treatment first or acupuncture, it doesn't matter. But you need to get those really hard, tight rocks of trigger points and adhesions. You need to get them broken up first so they stop pulling on those bones.
That's right.
So they stay in place.
Yeah.
And so that's all
of that alleviates pain. This is the most important part. This is all the technical details, but all of it is meant to alleviate pain, have your circulation flowing more healthily to and from the area. I mean, we want healthy circulation to and from the spine. That's everything. Yeah,
this is not just for local pain. You might be having migraines. And now that we see this person here, this model, how everything ties into everything, right? This point here, you can see the muscle strands going into the lower back. You see the muscle strands going up into the base of the neck and head.
Mm-hmm.
We see that. So when you're coming for treatment and we're treating here, it is also affecting your migraines and your headaches and your neck pain and your lower back pain. And here it then goes into your sciatica, which comes down to the leg. Sometimes we have back problems that are shooting around the side into the front.
Yeah.
Those are all some of the most common things we see here. And so that's oftentimes what you and I advise in the treatment room is you got to get these trigger points and adhesions broken up so you can restore the proper function back to the body.
That's right. I mean, proper function, proper circulation, all of that leads to a healthy and happy life. It's important. It's important. Yeah.
Now let's get away from some major rehab. Let's go into things that most people do to stay healthy. Yoga people, they do yoga to stay healthy, to be well, and they do it also to treat different lower back problems and neck problems.
Joint mobility is important. It's important, especially for women's health. I mean, yoga for everyone's health, really, but joint mobility, keeping the circulation flowing to and from the joints, especially with yoga, you're working on back bends, you're working on whatever area of your body where you're experiencing pain. I'm sure there's yoga asanas to help you with that. You want to be able to stretch, to bring that stretching in itself. It's not just the spiritual and mental aspect. The physical aspect is so important because what's going to happen is you're going to increase circulation to and from that area. You're going to bring your body's awareness to that area, and that in itself, I mean, having fresh and healthy blood flow to and from your joints and any area of pain is just as important as rest and Acu and PT and Chiro and all of that. You need that healthy circulation. Yoga is going to help that along, especially even with patients with neuropathy. We see a lot of that. The neuropathy patients that we have, almost all of them say in some way, shape, or form they're doing yoga or something of the like to help with the circulation, to bring the circulation to the extremities, to nourish those areas and get the healthy blood flow and circulation and sensation back in their hands and feet. It's really important.
That you bring up an excellent topic with yoga. That we what you just mentioned here about circulation into the lower extremities, legs, feet, even up the back. We call this the posterior chain. So all the muscle groups that go from here all the way down the back, all the way down to the legs, we call it the posterior chain. It's like this chain reaction of blood circulation and muscle function and posture, right? And so yoga is amazing when you start to do these different positions. They're a different way to stretch the body.
Yeah.
Right? And then I know that you specialize a lot in women's health because we see a lot of these yoga postures opening up the hips.
Yes.
Right? And so if we follow these muscle groups here to the front, how they wrap around and they come around to the hip, and then we look at all these intersecting different muscles, the adductors, the abductors, the quads, how everything comes right up into the hip here, all comes into the hip and then ties right into the core, right? And we see a lot of these positions are trying to open and stretch this open, right?
Yeah.
And a lot of women come into this clinic here and they talk about, they just feel like their hips are tight.
Yeah.
Causing back pain, causing other issues.
Pain wrapping around from the lower back to the front. I mean, there's so many different ways that it manifests itself, but yoga is phenomenal for that. And Acu, of course, is key in helping circulation to improve circulation to and from the hips, to improve circulation to and from the joints. Overall, just helping the body function at a more natural, not just higher function, but a more natural state of well-being.
I love when my patients come in and they tell me they do yoga. They've been doing yoga. They just started, or they've been doing it for years. They go to classes. They have a home practice. Yeah. They follow a YouTube channel to follow practice along, or their favorite their regiment. Right. Yeah. They have a certain order that they go through that they really enjoy. Right. And so I love when I hear that because I know that they're going to be doing some home therapy as I work with them, and they get a better response. Yeah. Now, I call this sports acupuncture, yoga acupuncture, or positional acupuncture. Yeah. And what I mean by that is when people who practice yoga, they know their body really well. They know it better than other people who don't do so much with their body. And they can pinpoint, I'm always doing this
when
one.
I do this motion.
I always do this one motion. When I go into downward dog or when I go into a certain position, I always feel this one spot. Yeah. I always feel a band that comes down over here. I always feel some tension in one zone or one area. Yeah. I say, I can help you.
Yeah. The same with I mean, not just our female patients doing yoga. We have MMA patients, male, female, whoever, anyone that is doing a physical art where they're more in tune with their body, they're keeping active, they're doing these repetitive motions where they know what their normal capacity is. And sometimes, you may pull a muscle. They'll know, if I sit in this position or I try to stretch in this way, I feel it here, I feel it there, and then that they can really understand and grasp the concept of this is an adhesion, this is an irregularity in your tissue that we can help with. I feel like sometimes people don't always understand what we mean by adhesion, but that's, to me, that is the perfect example. Someone
They're
that
knots.
really, little knots in your tissue.
We call them knots. We can all feel around. They feel like little rocks or
Yep.
little hard patches of muscle. And people who practice yoga or are very athletic,
Yeah.
or they do CrossFit, or they do a lot of moving around, or they always feel an area or a
Jiu-jitsu and all
spot.
that.
Jiu-jitsu, they always feel a spot that's holding them back. That they always feel
It's just inhibiting their
It's
range
their-
of motion. They
it's their
feel it.
weak spot.
Yeah.
They might call it too. This is the time for acupuncture, because just like when we were talking about PT and trigger points and knots, this is the same deal. Is we're going to go back where you find that spot and we're going to break that spot up.
Yeah.
And it leaves a permanent change.
Absolutely.
You don't need to
allows the
get
area to
20
heal.
treatments to break up a knot. You'll see it immediately.
Yeah.
In the first treatment or the second treatment. It's usually one or two where you see that change and we break that up, and then we have you in the office get in that position. When I do this, I'm like, okay, I'll stop you. Okay, get in that position. Whether you're going up a stairs or you're going into a certain yoga position,
Yeah.
we want to get you in that position, and we will take a point and we will break it up as you're in that position, because we'll get that exact fiber exactly where it is.
Right.
We'll have you relax, go back into it, and you'll say, wow, this is the first time I felt a big improvement in there. So the improvement is in seconds.
It's immediate.
It's not in weeks or months. It's like right now.
And it lasts. That's
It's a
the most
permanent
important-
change. It's
Yeah.
a permanent change because we actually broke up that tissue.
And it allows the area to heal. It's less likely that it can ever happen again. It does happen, but when it does, it's not as bad because your body's already working on that area. The tissue is being corrected.
I have a lot of golfers. They come in with a lot of
elbows.
golfer's elbow, and we have tennis players with tennis elbow, all in around the elbow area. All we do is we go in there and we break up all those knots and adhesions, trigger points. We just break them all up, and then we have them test it out. Hey, should I go golfing this weekend after you just worked on me? Yes. As long as they don't have any other factors that will disqualify them from going back into, more times than not, 80% of the time, I have them go back to golf. I have them go back to yoga. Whatever your sport is, I have you go back to your sport, because as you train, after I broke up that adhesion, when you start training while it's healing, those fibers heal in the correct direction.
That's right.
So we break up those fibers, those knots. They heal in the correct direction as you're using them, and now it's gone.
Yeah, it's amazing. And every time, patients are more than happy. They're blown away because they don't expect it. They're so used to a slower process of therapy, a therapy that may take months or weeks, but with this, when it's these type of issues, we're just so happy to offer that therapy because it's so effective, it's so fast, and it's lasting. That's the most important part. It's not like it may come back in a week or two. It's more often than not, it's a lasting benefit, and you may have to see them once in a while for maintenance. It's amazing.
Now we've talked a lot about how to incorporate this with your physical therapy, your yoga practice, your chiropractic, your sports, your activities, on how this can help you and get rid of your pain. But I want to talk about a mixed condition. Let's talk about headaches and migraines.
Sure.
Right? So you might go get diagnosed with migraines or tension headaches or cluster headaches, and you get medication for them. And we all know that when you look these up, these are vascular and sometimes neurological conditions. And then you will say, I have to take these medications, and I might do some of these other things at home to kind of help them, but this is it. I take the meds when I have to, and that's it. This is my life. Maybe they'll kind of get better, or maybe I can manage it with these drugs or something. But I got to tell you, between 60% of the time, acupuncture in this exact technique of breaking up the knots, these people who have these horrible migraines, if you just palpate and you feel all around the base of the skull, all down the neck, shoulders, and the back, they have these massive and tight trigger points and knots.
And they've had them for years. They just live with it.
Right?
Yeah.
And even down the side of their neck, they have all these points here. And then sometimes we forget that our head is full of muscles.
Yeah.
They're thick, but they're thin, fibrous muscles, and they cover the sides of the head. And
Any tension
these are
there is
points
gonna
of pain.
Yeah.
Our most common one is the temples.
Yeah.
That's the temporalis muscle. That's why when we rub it, it feels good.
Mm-hmm.
We're actually massaging a muscle.
Bringing circulation to that area, you know, it's helping the circulation move in that area, especially with any fixed pain, temporal headaches. It's you massage that, you're pushing the blood in and out of that area. It helps alleviate the pain. And acupuncture is great to do that. We can do that for you and make it a lasting effect because we're going to relax these muscles, remove any adhesions, get circulation coming to and from this area, and that's going to alleviate those migraines and tension headaches.
I mean, you and I, we see tons of migraines, headaches, and different types of neurological conditions that affect even TMJ.
Yes.
That affect the head, the headaches, the pain all around the head, neck, and scalp. And we start very simply just putting these points and finding these trigger points and knots all around. And they come back the next week and they say, hey, I'm starting to feel better from that.
And sleep better.
And they sleep better.
It's like that's one of the biggest things with TMJ.
They say, I thought this was only vascular. I'm like, yes. I mean, the root cause of these tension headaches that you're having or migraines you're having is vascular, it is neurological, but you've had them for so long that it's affected the muscular around the head. And now we reduce their pain by 65% because we got rid of the secondary problem, which was all the muscle tension around their head. So they'll get their migraine still, but now they need half as much medication.
Yeah.
When they have the migraine, they have these TMJ episodes, they're not as bad anymore. And they're like, oh, it kind of feels like when I was starting to first get it, but then it goes away quick. And now it doesn't hurt so much.
They don't last as long.
And so to them, their symptoms are 80-90% better.
Right.
And they're like, well, that's amazing that just by loosening up the scalp muscles that it did all that.
Yeah. It's amazing. I mean, the benefits that we can offer for migraines and TMJ, I feel I don't know any other therapy that can do that. I know a lot of people, they come to us with TMJ and there's very few options for people with TMJ. They offer mouth guards. Most people don't want to sleep with a mouth guard. So I'm always happy to help our patients if they have TMJ. I think that's amazing that we can offer that therapy. I mean, I say it all the time because it means so much to me. When a patient comes in with TMJ, it's disturbing their sleep. When it's disturbing your sleep, it's disturbing your waking hours. It affects you while you're at work. It's a constant. It can be a constant issue and reminder and of that pain. It's usually there, always there. That jaw pain that just doesn't subside, and in a few treatments, in one treatment, they can have such a phenomenal improvement. It's I wish more people knew about it, really.
And I think there's one more condition I want to touch on: carpal tunnel.
Oh yeah.
Carpal tunnel. So this is the inside of the wrist right here, right there on the model right there. And we're talking about the median nerve and the flexor retinaculum. And you can actually see the flexor retinaculum on this model, it just means it's a band of fascia that goes around, it's a ligament that goes around the wrist right here that holds all the tendons in the carpal tunnel so they don't poke out when you flex your wrist. And so oftentimes what happens there, it kind of presses on that median nerve. That's the nerve that comes in here that makes your hand work and feels temperature, right? And so what that does is that in that tunnel, this band right here presses on that nerve and you feel the pain usually in these first three fingers and sometimes a little bit of the fourth finger. And it hurts, it's painful, shooting. You can feel numbness, you can feel tingling. It can be very painful.
Nerve-ending pain.
And so now this is a knot in that tissue, in the flexor retinaculum. So we just take a point and we just loosen it up right there. And all of a sudden, this big whoosh of heat comes through your hand because now the circulation has come immediately back to your hand. Mm-hmm. And now your pain is reduced by 30 to 50% in one shot.
Yeah.
Right? A lot of people, that's what they experience. I know.
All you paralegals out there.
We're all texting. We're all typing.
Yeah.
We're getting wrist and hand pain. It may be diagnosed as carpal tunnel. It may not be. It could just be just starting.
Yeah.
You know, we love to get people who are just starting to have these pains.
That's the best time.
They go away so quickly.
Yeah. I mean, waiting is never the solution. Don't wait. If you get these type of symptoms, the sooner you're treated, the better. The more likely you're going to get noticeable improvement, lasting improvement.
I'm always telling my patients that knots. They grow like vines. Now, if you look at the striations in muscle tissue, which is like the lines in muscles, the pattern that the muscles have. So if you take a look at the latissimus dorsi, the lats that we call them, we see that there's this big lower lat right here that comes down like this. You have all these lines that go in this one direction, and so a knot will form right there. And because now that stopped the motion, another knot will form there, and then another knot will form there, and it'll keep forming there, and now they'll start to spread out, and all these knots will start to form like vines. And you used to have this one spot that hurt here, or maybe in your neck, and now it starts to spread and hurt more in a bigger area. And now when it's really bad on some days, it'll go down your back a little bit or up into your head somewhat. We get patients all the time saying, it primarily hurts in my left trap. I have a big knot right there. And then when my pain gets really bad, they'll say, when it gets really bad, it'll go up into my head or my neck and then somewhat down my back. But it all started in one spot. And then these knots, they grew kind of like vines. And so now not only do we have to get the root spot of that knot, we have to get all the little ones too.
Yeah, the peripheral area. Yeah.
But if you can just come in with one knot and we zap it, just one spot, 2 treatments, you're basically done.
Yeah.
All right. Huge improvement off the bat. But I just want to share one story about a gentleman. So, and this is his specific case. It's what worked better for him. It's not indicative of anything of who he saw or anybody. But so he came in with I saw him when he was 35, and he had this horrible left shoulder arm pain. He couldn't actually move it or lift it or pick up any weight anymore at 35, and he was a very fit individual. Worked out every day, but he couldn't do pull-ups anymore. He couldn't do push-ups. He couldn't lift a box heavier than 10 pounds because of his pain, all in here. And it started here, and it wound up being almost his entire arm, a little bit past the elbow into his forearm. And he went to physical therapy 2 to 3 times a week for over a year.
Wow.
And I said, okay, like, so what improvement did you have over the course of a year? And he said, absolutely zero.
Oh no.
And I was like, 0 for a year? Like what were you doing there? He says, well, we stretch, we strengthen, we do range of motion. And I was like, and I had doubts. I was like, I don't know how I'm going to treat this person. And then as soon as I touched his arm, I felt all of these trigger points, all of these knots, all of these adhesions. It just had grown so much over the course of the year. He was saying it's actually starting to feel worse. I was like, worse. It all stemmed from one event that he had where he did like a little bit too much, and then it all went downhill from there.
Yeah. It
started as one little thing, one little knot, and it peppered into his entire arm. And I said, I wasn't optimistic about it. I should have been, but as soon as I touched it, I knew exactly what it was because I could feel all these knots and trigger points immediately. Like, they're so obvious to an acupuncturist or your physical therapist on what they are, where they are, and how to treat them.
Yeah.
They're so obvious. I looked at him and I said, I can help you, but it's going to take me a couple tries. And it's going to take a lot of points because there must have been 75 different spots. I'm not even exaggerating on how many points I had to work with every time. And he was a very straightforward, good to go guy, like no cutting corners. He says, I want you to do as much treatment possible on me as you can. I don't care. I had this man, he's great sport. I had him in push-up positions on the floor, holding his push-up position so we can find every little spot that was causing him problems. And I would do a point, I'd break it up. I'd have him do some more movement. I'd break up the next spot. I would spend 45 minutes with him.
Wow.
I saw him for 2 weeks, and he was 65% better.
Nice.
And he hadn't felt any relief in 1 year of traditional therapies. And then I had him 100% better in, I think, 3 to 4 weeks.
Awesome.
But he really, not everyone wants to have that much therapy in one time. And so, which brings up a really good point is an acupuncturist, when you come here, we give you the treatment based on your needs, the kind of mood that you're in, the kind of experience that you want. We're going to recommend, what the best therapy is for you, but you're like, you know what, that seems like a lot, or I just want to start out real slow.
Right.
I just want to take it easy for a couple sessions.
Absolutely, yeah.
We can do that for you.
We are great with first-time patients. I mean, we're looking to empower our patients to get them back to doing what they want to do in their life, but we're not gonna throw, the whole stink at you. If you've never had Acu before, that's not. I mean, this might sound like aggressive therapy for some people, but we're definitely we tailor fit every treatment for every patient. That's the goal, because we want you to get the best from the therapy and not overwhelm you at the same time.
More therapy is not better.
Right.
It's not faster.
Right. And it's no one size fits all. We don't do that type of medicine. There's no one answer for everyone. It's what do you need? What's your condition? What therapies we can offer you, and what you're ready to experience. Because some people they wouldn't be okay with getting into a push-up position, or wouldn't be comfortable doing it, and that's fine. We still have solutions for you as well.
Yeah, he was a very unique case. This was just at his limit. But acupuncture is not one thing. It's not just needles.
Right.
Just like I was explaining, we do trigger point and knot acupuncture, where we zap out the knots, where we go in there and we break them up. But there's other acupuncture where we help balance your water metabolism. You don't feel those needles at all.
Yeah.
We're working with the neurological system, right? And all of a sudden you start to feel your stomach rumble, and you start to have that little bit of swelling, puffiness, deflate in your abdomen as your body processes that water. It doesn't hurt. It wasn't even uncomfortable. You just have this nice result compared to we're breaking up knots and trigger points.
Yeah.
Right? And then we have cupping. We have gua sha, which is like a scraping technique, which brings up the toxins to the surface. We have a lot of different techniques. I mean, we will actually do...
Moxa.
We have moxa. We have range of motion exercises. We can do stretching with you.
Heat therapies.
Heat therapies, infrared, laser, cold laser. There's so many different techniques and therapies that we have for you that the first time you come in, we hear you out. We listen to your whole story. We're probably going to ask you a lot more questions than anyone has ever asked you, including your medical doctor, because all of that matters.
Yeah, I mean, we're looking to not just diagnose one little issue. We're looking to treat the whole body. We're looking to help you recover from the root up. It's not just, I just have this one issue, and we don't focus on just the piecemeal. We're looking to give you a full therapy, a full whole body treatment that's going to give you a lasting effect and lasting benefit from today forward. We're not
nutrition and supplement recommendations too.
Everything. I mean, we're looking to help the patient through and through, not just treating the issue today, but giving you tools and tips and therapies that can help you from preventing these issues from coming back in the future. So that, to me, is also an important part of what we do. We're looking to help people make healthy lifestyle changes that can prevent them from hurting themselves in the future, and also getting them back to what they want to do in life. Some people want to be out running every day, doing their jujitsu, out in the garden, on their bikes, running with their dog, whatever you want. We're looking to help you get back to that life and do it, for a long time to come.
We want to help you achieve your goals.
Yeah, that's the goal. I mean, it's a whole process, and that's what we're here for. It's what we're here for.
All right. Thank you so much for joining us for another podcast. We'll see you soon. Stay well.